I'm Dr. Umesh Khanna, a practicing nephrologist from Mumbai. I'm the director of Kidney Associates, a nephrology firm, which means we treat and prevent kidney diseases. I also happen to be the chairman of Mumbai Kidney Foundation, my NGO, whose main job is to prevent kidney disease in the society and to help kidney patients. Today, I would be talking on the steps to keep your kidneys healthy. So there are one or two simple points, like kidneys would be kept healthy if you are healthy. Also, if we know what are the reasons for kidney diseases, we would be also able to deduce what can be done to prevent kidney diseases. So 60 to 65% of kidney diseases occur due to diabetes, blood pressure, obesity. The other 30-35% would be due to miscellaneous causes. Top amongst them is 1, the medicines which you consume, some of which could be harmful. 2, people who have stone disease and recurrent stone formation, they tend to damage their kidneys. And 3rd, repeated attacks of urinary tract infection. These, apart from genetic causes or causes which are hereditary, they form the bulk of kidney diseases. So when I tell you that how to keep your kidneys healthy, we need to look into all these aspects. Let's start from the simple things. One of the simplest form of advice that we give people is to drink plenty of water. Now, this advice you would have heard multiple times, but you would wonder what is plenty of water. So around 2 liters of water is considered as healthy, although it will vary from culture to culture, from weather to weather, and from individual to individual. Now, you should not keep on giving advice to everybody as to you drink more water. For example, if somebody has a kidney disease, liver disease, heart failure, to these people, you should not advise them to drink plenty of water because they already have water excess in your body. But in general, a normal person, to prevent kidney disease, drinking adequate water is a good habit. The other good habit is to try and not hold on to your urination and to find regular urinals wherein you will be able to pass urine, or areas whenever it's time or an inclination to go to the toilet, you must go and pass urine. These two are the general advice. But otherwise, if asked a question as to how to keep your kidneys healthy, our foundation has started campaigns for the society to keep their kidneys healthy. The first campaign we started, which all of you all should adhere to, is Ek Chammach Kam campaign. That means 30% reduction in salt, sugar and oil from today, starting from today. That's called Ek Chammach Kam. If you start reducing your salt, oil and sugar, you control, or you kill 3 birds with 1 stone, which means you control your blood pressure, diabetes and obesity, all 3. So that's the first campaign you will join from today, Ek Chammach Kam campaign. The second, and that's again a very important campaign, is Know Your Numbers campaign. That means each and every individual beyond 30 years of age should know his numbers, which means his blood pressure, his blood sugar, his cholesterol, and once we are discussing, and his weight. These 4 numbers he must be aware. His blood pressure, his blood sugar level, his weight, and his cholesterol. From time to time, he should be able to check these and know the values. That's called Know Your Numbers. The third campaign, again, it has drawn a lot of youngsters into joining this campaign, is have a perfect figure. When I say have a perfect figure, I meant blood pressure should be perfect, 120 by 80. Blood sugar or HbA1c, 3 months blood sugar, should be below 6.5, preferably 5 or 5.5. Weight should be, your BMI should be below 25. In Indians, anywhere between 23.5 to 25. Now, when you have such figures, we call it have a perfect figure. Similarly, there are figures for how much should be your cholesterol, how much should be your creatinine, and so on. So, ek chammach kam, know your numbers, have a perfect figure. Once you join these three campaigns, you will be on the right track in preventing kidney disease. Now, since kidney disease is very common, and believe me, 1 out of 10 people listening to this broadcast could be having chronic kidney disease today or in future. So 10% prevalence of chronic kidney disease is a huge burden. That's because diabetes is very common, almost 10%. Blood pressure is very common, almost 25% of Indians. And obesity itself is also very common, almost 30% in cities and around 15% in rural areas. So all three illnesses being common, 65% of kidney disease is because of these three illnesses. So the second advice I will give you is, one, try and prevent the kidney disease. Second, diagnose it much earlier. And unfortunately, kidney disease is a silent killer, which means you may not know of a kidney disease till it is late. And hence we advise you to do regular health checkups. When I say regular health checkup, I mean checking a urine test which picks up something as simple as a urine protein in the urine. And the other one is to check a blood test called serum creatinine or a GFR. Now, these two tests hardly cost 250-300 rupees, but it will help you in picking up the disease very early. And why should you pick up very early? Because kidney disease is controllable to a huge extent and preventable in a many number of cases. We know now that there are drugs available which can stop the kidney disease even if you developed one. So regular health checkup. Who should do it? Anybody who has diabetes, anybody who has blood pressure, anybody who is a senior citizen, anybody with a family history of kidney disease, people who have a lot of arthritis or joint pains or headaches or backaches, because they will start taking a lot of painkillers and taking over-the-counter painkillers or even antibiotics which are not prescribed commonly, or even certain Ayurvedic bhasmas or powders or things which contain very heavy metals. All these will lead to a higher prevalence of kidney disease. Other than picking up early, you should consult a nephrologist to stop the disease very early. So somebody who has diabetes or high blood pressure, if his urine shows protein leakage, then now there are good drugs which will stop the kidney disease from further progressing. That means the person may not reach the stage of dialysis or kidney transplant. So that's another early treatment which will help these patients. So regular health checkup, and more importantly, kidney health checkup. So friends, kidney disease is common. It's preventable, if not treatable, and it is harmful. India cannot afford the treatment of kidney failure by way of either dialysis or kidney transplant. Both are expensive. And I'm aware that even if you are affording and you are one of the richest, you would obviously not want to develop a condition where you need to take the treatment of either dialysis or transplant. So to summarize or to conclude, kidney disease is preventable. How to look after your kidney? Drink plenty of fluids, pass urine regularly, start the Ek Chammach Kam campaign from today, reduce your salt, oil and sugar by at least 30%. Know your numbers of blood pressure, weight and blood sugar, cholesterol and creatinine, and keep a perfect figure which you can easily maintain if you can control your diabetes, blood pressure, obesity. Thank you for giving me this opportunity to help you take care of your own health, take care of the health of your kidneys. Thank you. From Mumbai Kidney Foundation. You can go on to our website, mumbaikidneyfoundation.in, and you'll get a lot of reading material on how to safeguard your kidney disease. With that, I sign out. I'm Dr. Umesh Khanna, a nephrologist and a preventive nephrologist. Thank you.